The priorities for nurse-led research in haematology over the next few years are going to be really quite groundbreaking, certainly with the advent of CAR T therapy. As we've heard from the lectures this morning, this is a fairly new therapy that's come into haematology across the world, and it's really going to be quite a game changer for us. CAR T therapy is a really exciting new field. And this is now becoming a treatment that's available for patients that were previously untreatable. They had refractory or unresponsive disease. So this is now a treatment that's open to a whole cohort of patients that previously their treatment options were very limited. So for nurses, this is an area that we can move into with regards to research. It's an unmet need, an area that can be developed quite extensively by the nursing research. How can nurses get more involved in research? Within most hospitals there's a research department, and I think that nurses need to be slightly more vocal probably within their own areas and think of how they can interact with their research departments, enabling them to develop ideas that they have and bring these forward into clinical practice. I think most nurses are quite shy or reserved, I suppose, in a way, and they find that research itself can be quite a daunting prospect. So giving them the opportunity, giving them the skills, allowing them from a ward base to be able to expand into research is quite difficult for some nurses to do, having that opportunity. There are of course research nurses specifically, and this is their job and their title and their role, but this is different to somebody who's working on a ward, who might have an idea that's very interesting and exciting, and it's been able to allow that person to flourish, take that idea and move that into an actual piece of research themselves. And I think this is probably where, as nurses, we need to be more supportive of our colleagues from a senior level down to a junior level and helping them to develop their ideas. The stage that nurses should really move into research, I don't think there is a specific stage. I think it has to come down to that individual and how interested they are in a topic, how they can develop that topic and move that forward. So I think that if you are a first or a second year qualified nurse, but you've got a great idea, why do you have to wait for another 10 years to become a senior nurse before you take that idea forward? I don't think time itself is specific. It's very much, have you got a good idea? Can you develop this idea? Can you bring it forward? And will people support you? Key points for nurses that are trying to get into research would be, the first one is really importantly to have a really good idea. And if you have a good idea, then start looking for colleagues that can collaborate with you and bring that idea to fruition. I think you have to have a really supportive team around you. You cannot do this on your own. You need statisticians, you need support from your managers, you need financial support, and you certainly need time and an awful lot of effort to bring that idea forward. So I think that's probably the key point.